There's more data on Ibrutinib here, which showed long-term follow-up safety data, response rates high. There was another trial in patients that had failed Velcade, again showing high response rate, high CR rate. And there was Ibrutinib plus rituximab in a relapse setting, which is going to be presented this afternoon. Again, high response rates, CR rate almost 40%, which is twice what you get with Ibrutinib, showing that rituximab does add something. Again, that's a chemotherapy-free regimen. So that's chemotherapy-free R squared. Is it chemotherapy-free? I think the key question is, can you use that in place of chemotherapy itself? And we will have a study in the UK opening next year, which is going to ask that very question. Elderly patient mantle cell lymphoma, Ibrutinib rituximab versus chemo rituximab. That's the trial. That will really test whether it's going to be useful in place of chemotherapy. The SPARK study is the study I was alluding to in patients that had failed Velcade. Over 100 patients, and as I said, exactly the same response that we saw with the first phase 2 study. So CR rate just about 21%, very well tolerated, exactly the same. So consistent with the previous trial, and when added to rituximab, certainly seems to be more benefit, and that's, I think, the direction of travel where that's going to go. In a chemo-free setting, and there are a number of trials incorporating Ibrutinib into chemotherapy that are ongoing as well. So I think in the next year or so we're going to see at meetings like this data on combinations that perhaps really will impact on the treatment algorithm for these patients. There was an interesting oral presentation yesterday looking at mutational analysis of the patients that failed to respond to Ibrutinib or had a short response to Ibrutinib, showing some patterns of expression of certain genes, particularly in the NF-kappa B pathway. So understanding where that drug doesn't work, where the problems are, will help, one, maybe select patients who shouldn't have the drug, or perhaps more rationally what you might combine it with to get around those problems. So again, as we understand more about resistance mechanisms to these drugs, then how we overcome that.